In West Virginia, fighting coronavirus is coming up against the business of keeping hospital doors open. Concerns here are less about preparation and more about the cash flow needed to keep hospitals open. Empty hospitals means millions lost as elective procedures are canceled and postponed.
Keep people out of the hospitals except those who need to be in the hospitals.
That ensures beds are available and non-infected patients aren't exposed. But there's also a downside. That's money these hospitals need to survive.
It's dried up revenue significantly in our hospitals, some to the point of a 50% drop. The layoffs have occurred. People are furloughed. Others have gone in reduction in force.
On the one hand, you want to hear that hospitals are at 50%. They're ready if there's an influx of coronavirus cases. On the other hand, it's a matter of, can you stay in business to even handle the coronavirus?
That's a challenge.
A challenge for a state that's already used to sparse healthcare options. They only have 68 hospitals and medical centers for nearly 1.8 million West Virginians. 2 hospitals have closed in the last 6 months alone.
We have a vulnerable population.
Nearly half the state's adult population is at serious risk of illness if infected with COVID-19, making it the most at-risk state in the U.S.
If they started having this large outbreak and then come into our smaller community hospitals, I mean, that could be a very bad situation because those hospitals could be overwhelmed pretty quickly.
It's a prime target, but the state's rural nature also means social distancing is, in some ways, built in.
And that continues to be either our Achilles heel or something that's really good for us.
Another thing that could be good is the $100 billion coming to hospitals from the CARES Act.
We have hospitals that are losing $500,000 to $1 million a day just in lost revenue. And so this money from the CARES Act would be very helpful.
Helpful, but by Senator Manchin's estimation, not nearly enough for hospitals already feeling the financial squeeze.
We've put all the money towards the financial crisis that's coming afterwards, and it needs to have the attention. But if you don't put the attention to the front line, if you can't keep hospitals, especially in rural West Virginia, rural America, then we've got no way to take care of our citizens as it goes on and there's other care needed.
Now, amid a national health crisis, the stakes are higher than ever, both for ensuring people can receive care and that they'll continue to have a place to get it.
And Allison, West Virginia isn't the only place where this is a problem or a concern. Just this morning, Ballad Health, a healthcare system provider that serves parts of Virginia, North Carolina, South Carolina, and Tennessee, they announced that they were going to have to furlough workers because they've seen such a reduction in the number of patients in their facilities. They're saying that these non-urban healthcare systems were already facing challenges, but now they're facing catastrophic financial challenges because of the coronavirus. Allison?
Ali, they've got good reason to be worried in West Virginia, but are the leaders there optimistic that they will be okay?
Look, Allison, in reporting this story, the thing that I kept hearing from officials on the ground is cautious optimism. They've got, as of the last time I checked today, less than 500 cases in West Virginia. Deaths there are thankfully still in the single digits. But that being said, and you mentioned this when we got into this story, West Virginia was slow to report cases because they lacked testing. Yeah. When I talked with Senator Joe Manchin, he said that's still a concern. They still need adequate testing to be able to keep the population apprised of what it's dealing with. And at the same time, he's also concerned about the amount of funding that's being put towards keeping these hospitals afloat. Yes, there's $100 billion already put towards it in the CARES Act, but he wants to see Congress go further in the next phase, estimating that he could want as much as $300 to $500 billion put towards making sure that these hospitals can stay afloat and keep serving these communities.
It is a scary situation to be dealing with, and we hope that they do manage to stay afloat. We know a lot of people will need them. Ali Vitali, thank you so much.
Thanks.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.